Dr. Cohen, when it comes to orthodontic, I'm very sure it's obvious actually that technology has made quite some advancement. Can you tell us a little bit of, I'm sure that there are some parents out there who still have, I don't know, maybe not a horror picture, but at least not quite as a pleasant picture about doing ortho than their kids today will have. Is that true or not? And tell us a little bit what is currently available, why is it better than 2, 3, 4 decades ago, et cetera, et cetera.
Yes, things have changed dramatically since I graduated from ortho school about 30 years ago, believe it or not. At that time, we put bands around each one of the individual teeth. We usually really had only stainless steel wires, which delivered a huge force to the teeth, made things hurt quite a bit. We used a lot of headgears at that point, which I haven't used a headgear in my practice for probably the last 15 years. And we've gone through a number of advancements, pre-adjusted appliances to allow us to make fewer bends in the wires. We now use some space-age alloy wires, nickel titanium, that came directly from the space program. And with the advent of the robotic wires that we use with Suresmile and our virtual treatment and ability to plan in 3 dimensions, it has really opened up a lot of areas for correction that we never could correct before.
I see. Well, so technology did not bypass dentistry and did not bypass orthodontics, huh? That's quite something. That's
absolutely, good. Absolutely.
Yeah. So does that mean the treatment is done a little faster than it used to be done? Is it a little more comfortable in terms of not coming so oft to the dentist? Tell us a little bit about some of those improvements.
Well, the really cool thing about what we're doing now with our Suresmile is that each of our cases is tracked. We have a complete database, actually throughout the entire world, of the 300 of us in the world that are doing Suresmile, that actually compares us to some of our original non-Suresmile type cases that we used to do. Statistically, our cases finish anywhere from 20 to 40% faster than they ever did before. Usually anywhere from 10 to 30% fewer visits, and usually another 10 to 15%, maybe 20% fewer wires. That translates into a few things. One, fewer visits is a lot less time missed from school and a lot less time missed from work. And it also, fewer wires and fewer wire changes adds a lot to comfort. The more you change the wires, the more the teeth get sore.
Wonderful. And of course, the few visits is coming in 2 ways. It's coming, while you're in the treatment, you don't have to go quite as often, 10, 15%, what you said. So, and also the treatment is 30 some more percent done faster. That's quite a bit, you know what I mean?
Yes, it really is. And that was one of the things that a lot of patients, especially adults, didn't like about doing orthodontic treatment, is that, if you have to be in treatment for 2, 3, 4, 5 years, as an adult, it really kind of gets in the way of your career, your family life. By doing what we do now, a lot of our cases we can finish in a year or less now.
Wonderful. Absolutely great. Speed. It's all about speed.
Yeah, but speed and accuracy. Accuracy is really kind of the cool part about it, is that our accuracy has also been proven to be much more predictable than it ever could before.
Great. Thanks a lot again. Very informative as always. Thanks, Dr. Cohen.